Hey everybody, welcome back to Beyond the Bump. My name is Erica B, and I've been gone a while. For those of you who have been watching, I don't think I've posted since December of last year, and there are several reasons for that. So I started my Beyond the Bump journey just kind of talking over a couple of topics and things that I felt like a lot of people don't fully get educated on when they are going through pregnancy and trying to get pregnant and postpartum and just dealing with a new baby. But shortly before Christmas, we found out that we are, in fact, expecting our own little boy. So we are pregnant. We are due in August. So any August mamas that are popping one out in August, listen, I'm right there with you through this whole summer of quarantining and pandemics and everything else. So I wanted to kind of post just an update video and everything that's been going on. So I am 22 weeks. I'll be 23 weeks on Sunday. So I'm 22 weeks and 5 days today, on May 1st. And everything has really been going well. So everybody who hasn't watched, I want you to go back and watch the video where I explained my journey from my first son, which was 4 years ago, almost 5 years ago at this point, because it was just a roller coaster ride. It involved preeclampsia and hyperemesis and everything pretty much in between, just as far as complications go. So this time I was really scared, and that's part of the reason I haven't been posting. I found out I was pregnant at 3 weeks and 4 days, which is ungodly early. Like I honestly wish that I could find out and be like, oh my gosh, you're 20 weeks, because some of my patients do that and they genuinely didn't know. And I'm not that person. So of course I'm like, as soon as the stick can turn pink, that's when I knew. And my period wasn't due for like a week, it felt like. So yeah, I found out at 3 weeks and 4 days, and saw my doctor probably around 6-ish weeks just for my first checkup. And at my second checkup, we were able to do a dating ultrasound, which is what we go by for as far as due dates. And then after that, it was like, I was in denial for a long time. So that's another reason that I haven't been posting. It took me a really long time to just wrap my brain around everything as far as being okay with being pregnant, number one, because people who know me know that it was really stressful on my body to have the preeclampsia, to be hypertensive afterwards, and to never have had my blood pressure fully be under control without medication and diet and exercise and things like that, and just knowing what I knew from last time. So this video is kind of emotional, so I apologize in advance, especially to other mamas out there who are just hormonal or just people who are going through living in this world right now. It's already emotional. So with that being said, I of course told my awesome midwife who delivered my son, like it was like, oh no, this is happening, and circumstances prevented me from being able to go back to her, which is like, was kind of devastating at first when we found out. But the doctor who backed her up, who readmitted me for my second time in the hospital last time, is who I'm seeing. And I've had a great experience so far. Obviously, I wish that I could have gone back to her, but I mean, I've kept her posted. I've kept her posted, and I know that she trusts my current doctor with my care. And so that's, to me, very reassuring. So with this pregnancy, we were able to find out what we were having, that we're having another boy, which is exactly what I wanted. First of all, I'm very, very, very territorial over my boys, that I did not want a girl. And so for moms who only have boys, or for moms who only have girls, the people who are like, oh, but you need you need whatever you get. And that's really hard to wrap your brain around sometimes. And it wasn't for me, because I only wanted a boy last time, and we had our son Ellis, and then we only wanted a boy this time, and we kind of played with the idea of a girl. But for the most part, we were like, we really know what to do with the boys, not boys, but boys based on what we have. are seemingly easy. And I've just being an emotional teenager and still remembering that I did not want to do that. So I had my reasons why I didn't want to do it. And so people that come up to me and are like, maybe it's twins so that you can still have a girl. And yes, those people might be watching this, and that's okay. That is like draining for me. And so they've gotten reactions from that because I did not want a girl. If it were a girl, if he were a girl, if he magically came out a girl, that would be just fine with me. We would still love him. But if you ask someone what they want and they say they want a boy, then leave it alone. Anyways, back to the story at hand. Obviously, my hormones have been increased since becoming pregnant, but right at the beginning, I felt no real change. I peed on several sticks because the line was faint, and I just had lots of friends and colleagues that were going through kind of the same thing, and many of them have had losses. And so for me, it was just kind of that question of why I should be able to continue to carry when friends, close friends, best friends have had losses through this process that they've gone through with me. And some of them have gone through it with me before, full pregnancies. And so I had to kind of deal with that and be okay with the fact that this pregnancy continued. And that sounds crazy, but once again, the mental health portion of my last pregnancy led me to this, and being a labor and delivery nurse also, and seeing things that people don't see outside of work unless they've dealt with it. So it made it kind of hard at the beginning to be okay. So we went, and I've had my blood pressure checked every appointment, and it's been good. It's been up and down sometimes just based on hydration status and wearing a mask for 12 hours a day at this point in life. But I have still been working. I've been cutting back to working like 48 to 60 hours a week sometimes, to trying to keep it under 36 hours, which is a normal full-time working nurse and a hospital schedule. So I've tried to only do 2 or 3 shifts at the most a week. And if I've done 3 shifts, then I kind of back off the next week and so forth and so on. But so far, it's really been well controlled, my blood pressure, that is. When my second trimester started, so around 14 weeks, I had my appointment, which was when we found out that Miles is a boy. And it's clear. For people who have not seen his ultrasound pictures, I will post it on at my Instagram page. So there will be a link for that, because my boys, they show themselves, they play with themselves. It gets a little bit raunchy in there. And so once my second trimester started, my doctor put me on baby aspirin, which is fairly normal if you've had preeclampsia before, because it thins the blood and it kind of helps to prevent blood pressures from rising to the point of severe range, which we have talked about is 160 for the systolic, or the top number, over 110 for the diastolic, or the bottom number. I've been clear of those numbers. I've not had any of those blood pressures, and I've made it more than halfway through my pregnancy. So that is truly something that's like a great thing. That's something that kind of took a load off my mind. Once we got to the second trimester, I had been through some morning sickness also, which I had lost 25 pounds with my first pregnancy. So I was really concerned about what happens if this doesn't go away and all kinds of stuff. And so I started getting sick at probably about 7 weeks, right after I hit the 6-week mark, which was when it started with Ellis. And I was like, oh, it hasn't started yet. Maybe I won't get sick. Yeah, no. I got sick at 7 weeks, and it probably got bad between 8 weeks and 11 or 12 weeks. By the 14th week, I had been taking several meds. So I was on Phenergan, I was on Zofran. I had tried taking some Reglan, which you can't take Reglan and Phenergan together. But Reglan is a drug that we give that kind of just keeps your gut moving. So I was like, oh, I feel like I'm so full, like I'll drink too much at one time. And because the sphincters in your esophagus, they loosen up, everything relaxes in your body due to the hormone relaxin that causes your body to stretch and have room to give baby space. And part of that entails things being able to back up more easily from your stomach back into your esophagus so you get the heartburn. So with that said, I tried to take Reglan for a couple days, but then I was like, this is not working. So I ended up with a prescription for Zofran, which is probably the most common drugs. There's been some controversy with it, but for the most part, after 8 to 12 weeks, many physicians are fine with you taking Zofran. So I was on that pretty consistently for 2 to 3 weeks, and then it did start to ease up. And then the Phenergan puts me to sleep. So I can take half of Phenergan. I still kind of take half of Phenergan if I need help with sleeping. Number one, because I work at night most of the time, and then sometimes I work during the day, and then when I'm off, I flip back and forth being a nurse. So sometimes it's just hard to sleep. And then there's a person inside, and then there's acid building up, and then these allergies, if you live in the Midwest like I do, these allergies have been ridiculous. So Phenergan and Zofran are actually antihistamines, which I found out with this pregnancy because I didn't take a whole bunch of that last time. I'd never taken Phenergan before this pregnancy because I knew it would make me sleepy, and I was working so much last time. So with this time, I was able to take just sometimes even a quarter of a Phenergan so that I could get my prenatal vitamins down and not get sick, or so I could rest, or just so I could, eat and not throw up. So it's been working really well. At 14 weeks, we added the baby aspirin, and that's been fine. I don't really get any effects from that. Other meds that I've been taking, I take the little Facebook vitamins, which you've probably seen if you have Facebook. They're called Ritual. They're like probably horse pills like any other prenatal, but they've got little beads on the inside and they've got oil on the inside, so you can actually see what you're taking. And the reason that I chose that prenatal, this is not an endorsement or anything like that, I had done some research on preeclampsia and what helps your blood vessels to open up, because if you recall from a previous video I did, which has been a long time ago, so I don't mind explaining it again, preeclampsia can start with implantation, when those blood vessels that are going to form your placental chain of blood vessels, when they don't spread out enough to give your baby plenty of blood flow. So even though it doesn't necessarily happen till the end of a pregnancy, the problem becomes an issue when you implant. So with that being said, I've been taking this vitamin before I got pregnant, just the regular prenatal version, or the regular multivitamin version of it, and I switched to the prenatal version of it when we started actively trying, which was in October, September, October, somewhere in there. And it has what's called choline in it. So choline helps to keep those blood vessels from constricting or getting tight. So it tries to keep them dilated and open enough for baby to get blood flow later, to keep the placenta healthy and all those things. So I found that out from my wonderful chiropractor who I've been seeing since 9 weeks with this pregnancy. I saw her with Ellis at 19 weeks because I started having ligament issues out of this world, and I thought I was having issues with sciatica. Sciatic pain is pretty much the worst as far as like being able to walk, being able to move. Well, mine wasn't much further than that. I ended up with what's called symphysis pubis dysfunction, where the bones in your pelvis, they don't actually they're not fused in the middle, and that's so your hips can spread, but the ligament in the middle can kind of relax too much to where your hips start to be misaligned completely. And that's when you see those women with the waddle. You'll know what I'm talking about. The pregnant women who just look like they're just waddling along, that will be me. It's probably been me at some point already because I get it pretty bad, and I've already started to see it when I wasn't going to my chiropractor regularly. So I go to her at least every 2 weeks, and then she'll squeeze me in if necessary. But she's who told me about the choline. And so I made sure I got a prenatal that had that in there. And then she's also the person who told me about folic acid versus folate. So Ellis had the tongue and the lip tie. So that's what we call a midline defect. Same as if he would have had like a cleft lip, cleft palate, that kind of stuff. All those are midline defects. And so she said that sometimes we take so much folic acid because women in childbearing age have to have 400 milligrams, micrograms, something like that. Don't quote me on that. Of folic acid every day. So we take this vitamin that has all this folic acid in it, and folic acid is actually the synthetic version of it, and folate is the pure version. So I did some research on that and found out that yes, that actually can cause overgrowth instead of the undergrowth of these tissues in the mouth, the palate, the spine. If you don't get enough of it, you can actually have too much of the synthetic version to where your body doesn't break it down. And so then you have tissues that can't be broken down that are supposed to break down. So I made sure to get a vitamin that has folate in it and has enough of it. It doesn't all have to be folate. And I think some of mine is folic acid. It's a portion of it that is folate. That's a natural version of it. So I'm taking that prenatal vitamin mostly for those reasons. Of course, iron, vitamin D, if you're low on those things, is very important to increase during pregnancy. So I do take, not iron this time. I haven't needed iron, but I do take a vitamin D supplement because working at night and not going outside can make your vitamin D critically low, and people feel like they're anemic almost when their vitamin D is low. I know I felt cold all the time, tired all the time, almost depressed from having a vitamin D that was critically low. So make sure if you have had those things in the past, or if you're not sure, that you get those checked out. Thyroid function is also important. So if you're not sure, if you haven't had a thyroid check, that's something that I would recommend doing just if you find out you're pregnant or if you're trying. So back to the meds I was taking, or I am taking. I'm taking, to recap, a prenatal vitamin, a baby aspirin, a Phenergan if I need it to help me sleep. I haven't had to take Zofran lately. I started taking Tums like candy, and so I was actually prescribed omeprazole, which is a proton pump inhibitor. Basically, it's for acid. It helps to, or actually, it's not a proton pump inhibitor. It's a H2 agonist, antagonist, something like that. Some pharmacist was listening to this video and is cringing, but it's basically to reduce the acid in your stomach so that you don't have heartburn, which I had with Ellis also. And what else am I taking? Vitamin D supplement on top of the prenatal vitamin that has it, because that's how low mine has been in the past. And I think that's it. So that started all around 14 weeks. I was probably on that whole regimen. I'm still pretty much on that whole regimen. And at 20, almost 21 weeks, I was sent to see a high-risk doctor or maternal fetal medicine or perinatologist. All of those could be the same type of person. And he did my anatomy scan, which is where they look and make sure baby has all the parts that they're supposed to have and they're all functional. And the fluid's good, and the placenta's good. And so all of those things were normal, great, which was a huge relief. And I think that's when I was starting to be able to want to come back and do posts, because I was like, okay, I've seen a lot of things. And if you're a labor nurse, you've seen a lot of things. And if you've been through anything, you've seen a lot of things. And so I really wanted to make sure that I was in a mental space where I could deal with whatever comes after this. Not to say that everything will go perfectly, but I'm in a headspace now that I can handle that. So as far as the depression that I had last time, I haven't really had issues with depression. I've had bad days. I've had dark days. We're dealing with this corona stuff, and I'm still going to work in it. And, my work family has been very protective of me, but it's still scary. So when everybody else is staying home, my husband's working from home, my son's home a lot more often than he used to be, unless I'm working and need to sleep, working or I need to sleep, depending on if I'm working days or nights. He does still go to our hospital daycare, which is great if you have the opportunity. But I also understand people who pull their kids out and are like, nope, never again. I get it. This is a different time. This is unprecedented, as everybody's saying. So you have to do what you have to do and what you feel is best to protect your family. And so for me, being able to have a healthy pregnancy for this child and letting my other child get social skills and annoy some other people, because he is 4. And if you have 4-year-olds, oh my, it's different. But, you know, we check, we make sure he doesn't have a temperature. We make sure he doesn't have a cough. We're doing everything that we can do. He wears a mask if we're outside the house and not at school. And we, of course, wear masks if we're outside the house. And we will continue to do so to protect those around us. And so that is something that I highly recommend for everybody because it's not really about you. And at some point, life's not really about you. We're trying to protect the elderly. We're trying to protect people like me who are pregnant and high risk, people who have high blood pressure, people who have diabetes. You know, comorbidity is not necessarily a big deal to us, but high blood pressure, we know somebody with that. Diabetes, we know somebody with that. Obesity, hello, I like to eat, and I'm sure a lot of y'all like to eat. And so if your BMI says you're obese, even though we're looking at you and we're like, girl, no, you look great, and that's true. But if you're considered obese, you are at risk, at a higher risk. You're in a higher risk group. So please wash your hands, cover your face, take care of yourselves, take care of your family. That's my PSA on that. And I'm not going to bring that up again because it's just nerve-wracking. So I went to the high-risk doctor. Back to that. He said everything looks great. He wants to see me again in June. So 6-ish weeks from now, 5-ish weeks from now. We will go back and see him again. And, I get to do a glucose test at my next doctor's appointment. So that'll be in 2 weeks. Not even 2 weeks anymore. What that entails is me drinking the glucola, which is basically, looks like Gatorade. Sometimes it's orange, sometimes it's like lime. But it's full of sugar. And it's not the most fun. You have to drink it within 5 minutes or it doesn't count. You can't throw it up. And for me, having been keto for a long time and low carb for a long time, and I'm actually trying to get back to that now, even during pregnancy, just lowering carbs, it's going to be kind of a shock to the system. I've never been into sweets. So it just determines whether you have gestational diabetes because it determines what type of tolerance. It's called a glucose tolerance test. So it determines how much sugar your body can handle in a short amount of time. And the reason that that's done is because our insulin needs go up with pregnancy because now we're providing insulin for 2 people. Once the baby comes out, then he has his own insulin also, even in the womb. But we are responsible for the blood supply that we give to our babies. So our insulin demands increase, and that starts around this time into the 3rd trimester. And so we have to make sure that our bodies can handle that we're not gestationally diabetic. I haven't had issues with blood sugars before, but it's just one more thing. My mother was gestational with me, so it does raise my risk for being a gestational diabetic. And that's just, something else I need, So I will be doing that here in 2 weeks, and I hope to make posts and videos and things about it so that people can see what that entails and what it looks like. But also I will be doing a 24-hour urine, which I will not post a video of me peeing for 24 hours. And I will get some blood work done called PIH labs or pregnancy-induced hypertension labs. And those are for my blood pressure, just to give my doctor a baseline as to where I'm starting in those labs. So if my labs are normal now, great. If we take them again in a month, in 2 months, and they're higher, okay, how much higher are they than where the baseline was? And I'm very, very comfortable with doing that because I want, obviously for myself, I want to know what the baseline was. And I also, if we didn't do those now and then I go into labor or I'm induced and we take labs at that point and they're sky high, it's like, well, how long have they been like this? It just gives us a picture of, is my body in danger from this pregnancy? And if so, how much? Are we talking like, let's keep you pregnant but put you on bed rest? Are we talking about immediate delivery? That's the type of stuff that we're looking at in those labs. So I will pee in a jug for 24 hours and we will check to see how much protein is spilling into my urine, which there shouldn't be very much at all. So that's the goal. And I can get into more of that once we get to that point of doing it. So in 2 weeks, I hope to make another video about the labs that I get done at my next appointment. So yeah, that's the update. The update is that I am almost 6 months pregnant, and so far so good. And mentally and physically and emotionally, everything is going well. So I'm glad to be back. I hope that I'm not going to take another break permanently like I feel like I did last year. But it was just so much going on with everybody being sick in the fall, and then me starting to get sick with being pregnant and just going through all that, and then with everything mentally just kind of draining with the pandemic stuff. So my intention will be that I will continue to post at least as often as I have an appointment to give updates, to do more videos on topics. Feel free to comment on what topics you would like me to speak on. I plan to kind of just talk about what I'm dealing with in that moment, as far as topics, complications, things that we're ruling out. But I'm always happy to hear from you guys as to what you want to hear from me. So this has been Erica B at Beyond the Bump. Thanks for watching.